and others that might be in the unit where you are working. Another advantage is that you can work in a patient's natural setting. It's really nice to be able to get to know the patient's family, get to know their likes and dislikes, hobbies that they might have, ways that they like things done, what's important to them. In their natural setting, you can achieve this in a very, very good way. Some of the disadvantages to working in the home health field is that there is quite a lot of travel involved. You will be seeing several patients in the course of a day. That means that you will be needing to drive from one place to another, and depending on where the home health agency is and the distance from the different patients that you will see, it can be quite extensive. Another disadvantage is the amount of paperwork. This is true for professional staff, particularly in home health, but is also true for a home health aide. One thing that can be a disadvantage is the lack of connection with other employees. Some of us are much more outgoing than others and rely heavily on the social connections that we make with fellow workers. If you are working in the home, you are working quite independent of other folks, and it is more difficult to get to know your coworkers. Another disadvantage is that there is lack of immediate professional assistance in the home. If you are working in a hospital or nursing home and there happens to be an emergency, someone falls or somebody is starting to choke on a piece of food, you can just step out the door or you can put on a call light and someone would be there immediately. Obviously in the home, that is not the case. Even though you would have a cell phone available to you, it is not as immediate as it is in these other facilities. Home health aides have lots of responsibilities. Some of those responsibilities are to assist with personal cares. Could be bathing, dressing, and grooming a patient. Might be involved in activities of daily living, such as ambulation, toileting, or feeding residents. You might be assisting with mobility devices, helping people use canes, or assisting them with a walker. You might be using a mechanical lift. A lot of the folks that you care for in the home have some type of paralysis. They may be paralyzed from their waist down or sometimes from their neck down, and they will have mechanical lifts in the home that you will use to get them up in the morning, transferring them onto the toilet, into their wheelchairs, and then back into bed at the end of the day. Another responsibility of a home health aide is to assist with some household management responsibilities, as well as light housekeeping. This could include washing clothes for the patient, not for their entire family, but you may be asked to do some washing of the patient's clothing. You might do some vacuuming. There are some things that are not included and are not considered light housekeeping, and it would not be your responsibility to shampoo carpets, to clean closets, or to wash windows or floors. Those are things that would be not the responsibility of a home health aide. You would also be involved in planning, preparing, and assisting with the serving of nutritious meals, and helping maintain a safe environment. Ways that you might do that is to make sure medication is stored in a place where other family members cannot get at it. You would want to make sure there were not frayed cords or any kind of electrical wiring problems that you might find in the home. Another way that you would be maintaining a safe environment would be always using a gate belt with your residents. Medication administration would be another responsibility, assisting with the medication that they are to be taking. Grocery shopping might be another. Record keeping, making sure that accurate records are kept of the care that's provided is something that's very important. And also keeping your nurse supervisor informed of any observations that you make in the home or any changes in condition of the patients. Those reports to your nursing supervisor should be done right at the time that you are in the home or shortly after you leave the home. Don't wait until the end of the day. The nurse needs to know this information in a timely fashion, and also it's very easy to forget after you have seen several patients in the course of the day. There are particular qualities and characteristics that make for a competent home health aide. Some of these might include time management. As I mentioned earlier, you will be seeing a variety of patients in one given day. They are all expecting you at a predetermined time, so it's important to be organized and gauge your time and be efficient in the care that you're giving so that you can keep your time schedule accurate. You must also be able to be flexible. Sometimes you may receive a call from the home health agency adjusting your daily schedule. Instead of going to see a patient with who's had a stroke, you might be asked to go and see some other individual. So being flexible is an important feature of being a home health aide. Being dependable and punctual is very important, and it shows respect for the individual. Arriving late consistently or not showing up for work and having to have a substitute rather frequently certainly does not show respect for an individual. Honesty is also an important thing. Honesty in your record keeping. You will be expected to have a time and travel record where you note the exact miles on your odometer that you have gone with your car so that that can be reimbursed. It's important to be honest about